This is part B of the second lecture on respiration. It covers how to administer oxygen and the effects of smoking. It's important to know when and how to administer oxygen. Too much oxygen can lead to some severe problems in some cases. When is it necessary to administer oxygen? When the tissue level of oxygen is too low. How do you know when this is the case? You're going to look for the signs. One sign of low oxygen in the tissues is cyanosis. Cyan means blue and osis means a condition of. So this is a condition of blue coloration. You can see this especially in the lips, the tongue, and the nail beds. These pictures show you how that would appear. Another sign of low oxygen in the tissues is poor tissue perfusion. How do you know when you have poor tissue perfusion? These following signs will tell you that. If the person has a pale to gray color and cold extremities, if they're disoriented, and that's because there would be too little oxygen to the brain, if they have a decreased urine output, and this is because there's too little oxygen to the kidneys, a paralytic ileus, which means that the ileum is not moving, and that's because there's too little oxygen to the digestive system and peristalsis stops. Constipation, abdominal pain, bloating, and vomiting are all signs of low tissue perfusion. If you determine that you need to administer oxygen, there are a number of different ways that this can be done. The nasal cannula, the face mask, the face tent, an endotracheal tube, and hyperbaric oxygen. You need to decide which is the best way to administer oxygen for your patient. A nasal cannula is a device that consists of a lightweight tube which on one end splits into two prongs that are placed into the nostrils and from which a mixture of air and oxygen flows. The other end of the tube is connected to an oxygen supply, such as a portable oxygen generator. A nasal cannula is generally used wherever small amounts of supplemental oxygen are required because it's not a very efficient way to administer oxygen. The simple face mask is a basic disposable mask made of clear plastic, and it provides oxygen therapy for patients who are experiencing conditions like chest pain, maybe a heart attack, dizziness, and minor hemorrhages, and it's almost 100% efficient. The face tent is a soft aerosol mask that fits loosely around the patient's face and neck. It's an alternative to the face mask, and it's used most often in cases of face trauma or if you have someone who has a feeling of claustrophobia. It's almost 100% efficient. Of the methods mentioned so far, the most efficient is the endotracheal tube. It's used most often when the trachea is crushed. Endotracheal intubation is a procedure where a tube is inserted through the mouth or nose down into the trachea. Before surgery, this is often done under deep sedation. In emergency situations, the patient is often unconscious at the time of this procedure. This diagram shows you how an endotracheal tube is inserted. Hyperbaric oxygen is the most aggressive and dangerous way to administer oxygen. It is a medical treatment that enhances the body's natural healing process by inhaling 100% oxygen in a total body chamber where the atmospheric pressure is increased and controlled. It's used for a wide variety of treatments, and it's usually part of an overall medical care plan. Hyperbaric oxygen therapy is a well-established treatment for decompression sickness, which is a hazard of scuba diving. Other conditions that might be treated with hyperbaric oxygen therapy include serious infections, bubbles of air in your blood vessels, and wounds that will not heal, usually as a result of diabetes or radiation injury. Just to recap, hyperbaric oxygen is oxygen administered under pressure. It is the most aggressive method of administering oxygen, and it is the most dangerous method. It is used with skin ulcers or gas gangrene in many cases, and it has the greatest risk of oxygen toxicity. Gangrene refers to the death of body tissues due to lack of blood flow or to a bacterial infection. Gangrene most commonly affects the extremities, including the toes, fingers, and limbs, but it can also occur in muscles and internal organs. The chance of developing gangrene is higher if you have an underlying condition that can damage your blood vessels and affect blood flow, like diabetes. Treatments for gangrene include surgery to remove the dead tissue, antibiotics, and a few other approaches. The prognosis for recovery is best if it's identified and treated early. There are two types of gangrene: dry gangrene, in which there are no bacteria but the tissue dies due to lack of oxygen, and gas gangrene, in which the tissue dies and anaerobic bacteria infect and produce a gas. The bacterium associated with this is Clostridium perfringens. Please view the next two slides with caution. They are graphic. The following slide is extremely graphic. Please view it with caution. Oxygen toxicity is a concern for underwater divers, for those on high concentrations of supplemental oxygen, particularly premature babies, and those undergoing hyperbaric oxygen therapy. The result of breathing increased partial pressures of oxygen is hyperoxia, which is an excess of oxygen in the body tissues. In adults, this can lead to vascular spasms, which can lead to strokes or blindness. In children, fibrosis behind the lens can lead to blindness. Here are some of the diseases of the respiratory tract: asthma, chronic bronchitis, emphysema, lung cancer, and cystic fibrosis. Chronic bronchitis, emphysema, and lung cancer can all result from smoking. I'd like you to read this slide, but you do not need to memorize the information on it. Every day in America, 40,000 people miss school or work due to asthma. 30,000 people have an asthma attack. 5,000 people visit the emergency room due to asthma. 1,000 people are admitted to the hospital due to asthma, and every day 12 people die from asthma. Here are some of the causes of asthma. They include food allergies, pollen, dog and cat dander, respiratory infections like the common cold, physical activity, and this is known as exercise-induced asthma, cold air pollutants like smoke, and excitement or stress. So how do you treat asthma? Well, if you have an allergic asthma, you want to first of all remove whatever it is that's causing your asthma attack. Then for short-term treatment or for quick relief, an oral spray of epinephrine. There are also some long-term medications that can be used. Immunotherapy or allergy shots are also helpful. No smoking and clean up the air. Please read but do not memorize the information about tobacco on this slide, except for the second point, and that is about 1 in 5 American adults currently smokes. You can easily see from this bar graph that the rate of smoking in the United States has steadily decreased since about 1965. Look at this map of the smoking rates of the different states in the United States. Kentucky has the second highest rate of adult smoking in the country and one of the lowest excise taxes on tobacco products. The low excise tax on tobacco products is one of the reasons why Kentucky has the second highest rate of adult smoking in the country. So what do you think? Is smoking glamorous? Here is one sad statistic. Of those who stop smoking at clinics, about 75% will resume smoking within 1 year. This is an indicator of just how addictive smoking is. So what's so bad about cigarettes? Well, here's a list of just some of the things that are in tobacco smoke. Let me tell you what's wrong with a few of these. Arsenic is rat poison. Phenol and formaldehyde are chemicals used to preserve cadavers. DDT is an insecticide. Lead and cadmium are heavy metals that can lead to brain damage. Long-term smoking has serious effects on many systems, but especially the cardiovascular and the respiratory systems. In the cardiovascular system, it can lead to CHD, which is coronary heart disease, stroke, and aortic aneurysms. It causes an increase in LDL, which is your bad cholesterol, and it decreases your HDL, which is your good cholesterol, and these two things together promote plaque formation. There are some long-term respiratory diseases called COPD, or chronic obstructive pulmonary diseases, and they include chronic bronchitis and emphysema. And then finally, lung cancer. About 80% of lung cancers are due to smoking. Chronic bronchitis is most common in middle-aged and elderly people. It can be caused by pollution, and it results in an excessive amount of mucus production and temporary narrowing of the bronchi and bronchioles. Because of this, people usually develop a cough and the cilia function poorly. They have shortness of breath, and chronic bronchitis may lead to emphysema. This slide shows you the excessive mucus production in the trachea of a patient who has chronic bronchitis. And remember, this is part of the reason these people develop a cough. Even more severe than chronic bronchitis is a condition called emphysema. It is the most common and crippling chronic respiratory disease. In this disease, the bronchioles are permanently narrowed and the patient has shortness of breath. Stale air accumulates in their lungs, and the available oxygen is reduced. They also have a loss of the elasticity of the alveoli. When you lose this elasticity, it means that a lot of stale air will remain in the lungs. Emphysema can last for years or for a lifetime. You can see the lung of someone who has emphysema in the picture below. The right ventricle of those with emphysema becomes enlarged because it has to work harder and often results in death. This diagram shows you a comparison of someone with normal alveoli in their lungs, someone with bronchitis, and someone with emphysema. Lung cancer claims more lives than colon, prostate, and breast cancers combined. It originates in the epithelial cells, and it is caused by carcinogens. Most cases of lung cancer are the result of smoking. Metastasis occurs in most cases. Metastasis means moving beyond the primary site. Without treatment, patients will live about 3 to 5 years. Here is an X-ray showing lung cancer. It's the white area within the circle. This is a macroscopic view of a lung cancer. Here is the list of the different treatments for lung cancer. In some cases, surgery can be performed, but usually it is inoperable. When surgery is performed, they can either do a lobectomy, which is the removal of a lobe, and remember that between the two lungs there are a total of 5 lobes, or they can do a pneumonectomy, which is the removal of the entire lung, and that occurs if the tumor is close to the center of the chest. Radiation therapy is the most effective treatment. It's the use of high-energy X-rays or other particles to destroy cancer cells. If you need radiation therapy, you'll see a specialist called a radiation oncologist. The most common type of radiation treatment is called external beam radiation therapy, which is when radiation is given from a machine outside the body. They usually set up a schedule that consists of a specific number of treatments given over a set period of time, and this can vary from just a few days of treatment to several weeks of treatment. There are side effects, and those include things like fatigue and loss of appetite. If radiation therapy is given to the neck or to the center of the chest, patients may also develop a sore throat or have difficulty swallowing. Patients may also notice skin irritation similar to a sunburn where the radiation was directed. Most side effects will go away soon after the treatment is finished. Chemotherapy is possible in some cases, but in many cases it does not work. It's the use of drugs to destroy cancer cells, usually by stopping the cancer cell's ability to grow and divide. It's been shown to improve both the length and the quality of life for people with lung cancer of all stages. Chemotherapy is given by a medical oncologist, and that's a doctor who specializes in treating cancer with medication. Common ways to give chemotherapy include an IV tube placed into a vein using a needle or in a pill or capsule that's swallowed. The side effects of chemotherapy depend on the individual and the dose that's being used, but they can include fatigue, risk of infection, nausea and vomiting, hair loss, loss of appetite, diarrhea. Targeted therapy is a treatment that targets the cancer-specific genes, proteins, or the tissue environment that contributes to the cancer growth and survival. This kind of treatment blocks the growth and spread of cancer cells while limiting damage to healthy cells. And then finally, immunotherapy, also called biologic therapy, is designed to boost the body's natural defenses to fight cancer or to boost the immune system. Here is a picture of a lung cancer patient post-surgery. Notice how large the incision is. This is a picture of Bill Tuttle, who was a center fielder for 3 different teams during his Major League Baseball career: the Detroit Tigers, the Kansas City Athletics, and the Minnesota Twins. He batted and threw right-handed, and he played third base for a brief period. He also used chewing tobacco during this time. Take a look at the bulge in his left cheek in this picture. Here's what happened to Bill Tuttle after years of using chewing tobacco. Bill was diagnosed with oral cancer at the age of 64 and died at the age of 69. The last 5 years of his life he spent in raising awareness as an active volunteer for the National Spit Tobacco Education Program of Oral Health America. Here is a sad statistic you may want to consider before you decide to smoke. For someone who smokes for decades, how much of a loss of life may this be? The earlier you quit smoking, the greater chances are that you'll reduce serious risks to your health. I hope you'll consider this fact. About 440,000 Americans die each year from diseases related to smoking. 90% of them started as teen smokers.